प्रियंका गांगुली, डॉक्टर नंदिनी कापुर এবং ডক্টর আলপনা মজুমদার। আমি আজকের এই তিন অতিথি বক্তাকে মঞ্চে হাজির অনুরোধ জানাচ্ছি। আমাদের আজকের সভাপতিদ্বয় অধ্যাপক গোস্বামীকে পুষ্পস্তবক দিয়ে বরণ করবেন আমাদের সমিতির সম্পাদক ডক্টর নীলরতন মহাপাত্র। অধ্যাপক সুব্রত মুখোপাধ্যায়কে পুষ্পস্তবক দিয়ে বরণ করবেন ডক্টর নীলরতন মহাপাত্র। আমাদের আজকের এই অনুষ্ঠান, আজকের এই সিএমই যারা সফল করার জন্য সাহায্যের হাত বাড়িয়ে দিয়েছেন, আমরা ধন্যবাদ জানাই সেই শ্রী দুধ কর্পোরেশন লিমিটেডকে। তাদের কথা আমরা শুনব। আমাদের সভাপতিদ্বয় তারা আজকের আমাদের যে তিন অতিথি বক্তা ডক্টর প্রিয়াঙ্কা গাঙ্গুলি, ডক্টর নন্দিনী কাপুর এবং ডক্টর আলপনা মজুমদারকে পুষ্পস্তবক দিয়ে বরণ করবেন। আমরা আর সময় দীর্ঘায়িত করব না, আমরা আজকে যে আলোচনা শুরু করব। আমি আজকে সভাপতি ডক্টর গোস্বামী এবং ডক্টর মুখার্জিকে অনুষ্ঠান শুরু করার জন্য অনুরোধ জানাবো, পরিচালনা করার জন্য অনুরোধ জানাবো।
Thank you, Dr. PRIYANKA. I extend my hearty regards to all of you, and I am thankful to my association, PASCHIMBANGA Ayurveda CHIKITSA SAMITY, that our Samity has organized such auspicious occasion and such type of program in every month. Today, there are 3 participants who will deliver their speech. Fortunately, these 3 are the students, and today's topic based on the cosmetology, cosmetology. Regarding cosmetology, my knowledge is very limited, and I think that it is a professional skill for beautification. The first speaker, my beloved student, Dr. Priyanka Ganguly. She is now attached in Rajiv Gandhi Ayurvedic Medical College and passed BMS on 2009 from Rajiv Gandhi Memorial College under West Bengal Health University. Completed MS in Shototantra in 2018 under the Rajiv Gandhi University of Health Sciences, Bengaluru. Received Yoga Teachers Training Program in 2009 from Patanjali Yoga Center, Bardwar. Received training on acupuncture on 2014 from SSKM Hospital, Kolkata. Received training on naturopathy and physiotherapy on 2013 under the Netaji Subhash Chandra Open University. Received training on clinical cosmetology on 2019 from K1 American German Aesthetic Institute. Presently working as assistant professor in the Department of Shalakotandra at Rajiv Gandhi Memorial College and Hospital, and she is the director of OHM Ayurveda Multi-Traditional Health Center, Cosmetology. She is very enthusiastic and energetic personality. From her student life, I know her, and I request Dr. Ganguly to present her paper. And one thing I like to say that I have to leave at about 3 p.m. due to my personal job, and the remaining program will be conducted by Dr. Mukhopadhyay. Please come, Priyanka Ganguly, for a valuable speech.
Before starting my presentation, I want to pray our Lord Dhanvantari, and afterwards I am starting my presentation. Om Namah Dhanvantari Adidevam Suda Sudai Vandito लोके जड़ा लोक भया मृत्युनाशं धातारमिषं विविधोषधं चट्टुमधातावानि वाणी पदही पंचोपंच आत्मगुण देखो भाजम संताप संपात जरा जरार्दुकम नमामि धन्वन्तरि माधिदेवम् नवीनो लीला मुदिकान्तिकान्तम् शान्तं हरिनाथशर्महा मूर्तिं कोटिशतानां शुभरुणरोत्थानं नमामि धन्वन्तरि माधिदेवम् ॐ शान्ति ॐ शान्ति ॐ शान्ति Welcome to all of my respectable teachers, colleagues and friends for this presentation. Before starting my presentation, I want to give a special thanks to Tuhin sir, Niravan sir, because they have given me this platform to perform and to express my words in front of all of you people. And another special thanks goes to my favorite sir, Anjan Goswami sir, because I requested once to come today and he gave my words. Thank you so much, sir. I'm Dr. Priyanka Ganguly, Assistant Professor in Chalakotandra Department from Rajiv Gandhi Ayurveda Medical College. Today we are doing, what is the topic? Cosmetology. So now the question is certainly why we are giving the emphasis over this topic and how it's becoming just the hot cake in the medical science. I'm going to explain. Actually, we are knowing each and every human being is having the simple wishes and dreams to achieve and maintain the glamorous, flawless and radiant look by stopping the aging process. That's why for the complete makeover, nowadays so many procedures are performed in the whole world. It has been seen that minimum 14.2 million surgical, cosmetic and plastic surgical related procedures are performing annually in the whole worldwide. So that's why today we are going to emphasize over this topic. My topic heading is a glimpse on cosmetology. Now the question is, what is cosmetology? Cosmetology, this word is the combinations of the two words. First one is the cosmetics and logy. Definitely we are knowing what is logy. Logy means the knowledge. So what is cosmetics? According to the Drugs and Cosmetics Act, cosmetics are the biologically active substance which can be poured, can be applied, even rubbed and sprinkled over the skin and the hair just for the getting, the cleansing or purifying or the promoting the beauty and all. So now the question is, so what is then cosmetology? So cosmetology is the science which is actually dealing with some procedures, not only that, even it is dealing with some biologically active substance which is actually promoting the beauty or just modifying the appearance or enhancing the attributes in the human being. Now the question, next topic, that is the history of the cosmetology. In our mythological science, already some examples we are getting. That is first example, that is Shiro Chandana, which never ever performed in the world. But in our Upanishad, we are getting this example. That is the, what you know, that is the Shiro Chandana. Actually, when Lord Shiva becoming so much, so much angry or over the Daksha, that time immense rage, he actually decapitated or beheaded Daksha's head. And afterwards, Daksha's head was again reassembled by Ashwini Kumars because they were the plastic surgeon in our Ayurveda. And that was the one example. Another example we are getting where the Vishabhara, she was the warrior woman. She lost her leg during the battlefield, and again it was reassembled by Ashwini Kumars. Okay, and by the using of the iron leg. That is the first example in our mythological science where the prosthesis has been used. Next, we are coming to the ancient history. It has been seen in the 3000 to 2500 BC. We are getting the first evidence in Egypt where the rhinoplasty of the broken nose has been illustrated properly over the papers that's called the Smith papyrus. Okay? Next evidence we are getting in India. On 600 BC, Acharya Shrishruta has described various kinds of Shandana karma. Shandana karma, that is the rejoining of the mutilated part of the body. So he had explained Nasha Sandhana or the rhinoplasty, Karna Sandhana, otoplasty and the Osha Sandhana or stereoplasty and all. Not only that, along with he has explained there are various kind of Shastra, Anushastra karma which is also helping to promoting the beauty and all. Not only that, even he has described there the Vikrita Apaharana procedures. Vikrita Apaharana that we are knowing, that is the Vikriti, whatever the Vikriti is offering after the healing of the any kind of wounds and all. So scar marks, he had explained nicely there about this total restorations of the normalcy for the scar and all. Now the next 300 BC we are taking Acharya Charaka. He had not directly explained any kind of procedures there. But he had explained there all kind of active herbs which is actually helping for the Barnia, Acacia, Sobandhya, etc. Afterwards, the 4th century we are taking the next example from Acharya Bhagavata, where he described the same thing, rhinoplasty and others, all kind of Sandhana karma. Along with he had explained like a limb attachment, okay, and using the drugs also. Next, we are coming to the modern history, where on 1st century AD we are getting the all the Celsus. He was the person who recorded all kind of plastic surgery very much elaborately, and afterwards the next one is the 1500, that is the Gaspar Jagalviji, who did successfully the rhinoplasty by the using of the grafts. And next one, on the 1793, the Francis Chopper did the successfully lip augmentation by the using of the flaps from the neck. Next, 1970, Sir Harold Gillis, who is coined as the father of the modern surgery, because during the First World War, so many soldiers became totally disfigured during the battlefield. So he did various kind of craniomaxillary surgery to again get back their actual appearance and all. Now coming to the branches of the cosmetology. There are two branches. First one, that is the medical, another one is the non-medical. Usually non-medical cosmetology is coined as the general cosmetology. Okay. Under these sections, usually the hair care, skin care, manicure, pedicure is coming under this section. And this section is actually handling by the salon experts. And another one is the medical cosmetology. Under that, usually the plastic surgery, cosmetic surgery, and non-surgical procedures, which is usually the minimally invasive or non-invasive procedures is coming. Actually, this section is handling by the doctors, the medical personalities, or the surgeon. So today I am going to emphasize over the medical cosmetology. So when you I am giving over this general cosmetology. In the market for the male and the female, the different products are available because the skin and the hair texture of the male and the female is entirely different. Male is having a little bit coarse and rough skin and hair than the woman. Okay, and not only that, even the body art and the piercing also coming under this section. For hair care also the same thing is there. It is standard products along with some coloring and the styling. It is also coming under this section. Now for the manicure and pedicure also we are knowing that is the manicure is the care of the hand and the pedicure is the care of the foot. So various kind of products along with nail art and mehendi are also coming under these sections. So now I am going to emphasize over the medical cosmetology. So I already told that medical cosmetology is having the cosmetic surgery and the plastic surgery. Now the question will be arise that both the word is same or any difference is there? 100% difference is there. For the plastic surgery, it is actually constructive surgery or the risk or any kind of correction is required. It is actually deep corrective surgery. Whatever the people are having the attributes, if it is getting disturbed or any deformation is occurring due to any kind of trauma or any kind of any congenital reason is there, that can be again corrected by the plastic surgery. As the example, the cleft palate, cleft lips. Okay, this is the congenital problem. Another one is any traumatic cases when the limbs are getting off. For that also, plastic surgery is required to again reconstruct the portions, right? Now next coming to the next, that is the cosmetic surgery. Cosmetic surgery is whatever the attribute is having in the people, it is just enhancing this appearance. Okay, it's just enhancing this one. So that is the basic difference. Just an example, like anyone having any lip related problem, they are thinking my lip is not that much plumper or not that much fuller. So for that they may go for the lip augmentations. So it is already their habit, they want to make it more enhanced. Okay, so this is under the cosmetic surgery. So what are the procedures which is coming under this one? This plastic surgery. Now I am going to explain. First one is the burn surgery. It has been seen in case of whenever it is only epidermis layer is involved for the burn cases, it is usually getting healed up within 3 weeks. But whenever it is becoming so much deep or it is introducing up to the dermis area, then the flap or the grafting is the one of the choice. For that, actually the donor part should be chosen. That is actually from the anterolateral aspect of the thighs or buttocks portion. So in this video you will see that first the donor part would be cleaned properly, shaped properly. Even the burnt portions also would be cleaned by the betadine solutions and all like that. And afterwards the isotonic solution would be introduced through the donor part along with the anesthetic agents. And then this is the dermatome which is having the blades or razors. By that, according to the shape of the burnt area, the layer, epidermis layer will be this area, and afterwards it will be again draping over the area of the burn place. And this is the mesh making meshes from that 1:1, 1:2 or 1:3 in this ratio. The mesh graph should be taken out to cover up the actual donor part. And at last, after draping the both areas, burn and the donor part, then again stitching and sometimes stapling also can be done, and afterwards the dressing is important for the hairline. Now coming to the television surgery, for that any kind of trauma, especially apart from the high altitude, like any kind of suicidal attempt or any kind of homicidal cases, not only that, even a road traffic accident, it also may cause sometimes the jaw, skull portions or neck portions getting injured. And for that, this is the traumatic reason. Another reason is that I already told, for the cleft palate or cleft lips is another cause where we are going for this maxillary or craniofacial surgery. Now coming to the traumatic injury. Traumatic injury means it may occur any part of the body. Okay, but the matter is most of the cases it has been seen the limbs or extremities along with the digits are getting off or amputation usually occurring. For that, the attachment is very important. If it could not be attached, then we can use this video also. You can see the plasticized portions we may again attach. So for the artificial nose, artificial digits, even artificial total extremities along with artificial ear also can be attached, and the special kind of glue can be used for that, and daily basis it can be again attached and detached. So function of those areas also getting obtained. So this is very popular nowadays. So now coming to the next, that is cosmetics. I already told it is only enhancement of whatever is already there. So under this topic, the facial contouring, that much procedures are there. Next one, for body contouring, are there. And the next one for the shading contouring. Nowadays it's also becoming very popular from male and female differently. The first one, coming to the face contouring, cosmetic surgery. The first one is the hair transplantation. Usually, the back of the scalp, whatever the hairs are there, they are actually very much dense in the quantity. And most of the cases, the anterior portions of the scalp becoming less. Okay, so for that, from the scalp portions, the minimum 60 millimeter like that scalp portions would be removed out. From there, 6,000 hair follicles would be preserved. Okay, and in this video also you may see after marking the layers is removed, and afterwards from there minimum which is having the single follicles, which is having the 2 or 3 or multiple follicles along with bulb. There should be follicles along with bulb. If it is transated, then it could not again regrow any hairs. So it should be in mind. And usually what happens, the single follicles are harvesting to the just anterior portions of the scalp, because there is required of the very natural look, and it will be little bit less portions will be there. And usually for the middle and for the back portions, the multiple follicles will be harvested. Now coming to the next one is the browplasty. Usually whenever the brows are becoming smoothing or it is becoming very much dropping down, it's looking so much aged. That's why the tucking is important. So how to do? First of all, in the usually the repositioning could be done with the use of needle, and the fixing is required. So for that, in the videos also you may see just 3 centimeters above the lateral end of the eyebrow and the middle end. After that, the one suturing should be done, and along with another one, that is the 7 centimeter just into the hairline. Another suturing should be done, and it will be tucked properly. Then another one would be whatever any kind of wrinkles or forming surrounding this forehead also, it is also removing by this browplasty and all. Next one is blepharoplasty. Blepharo means we are doing that is the eyelid. So usually whoever having the sagginess of the eyelid, not only sagginess, usually people are having the excess amount of the collections of the adipose tissues in the lower eyelid and the upper eyelid, especially for the Southeast Asian people, you can see like that. So for that also is looking into these ages. So for that the excess amount of adipose tissues would be removed out. It's also having the clinical importance because sometimes the aged person, due to the excess amount of the sagging of the eyelid, they could not see properly. They are suffering from some impairment of the vision. So for that also is very important. Now coming to the next one, that is the rhinoplasty. That is, we are knowing for the shape of the nose, usually the dorsal humping, it is actually whenever it is becoming so much wide, then the nose shape also becoming much wider. Even for the septal cartilage, is also giving the shape of the nose tip. Okay, so not only that, even some people are suffering from the deviated septum, which is also forming some, which is also causing of the distress of the respiratory distress, and also for that it's very required for the rhinoplasty. First one incision will be given and the septal cartilage would be removed, and afterwards by the using of the surgical hammer, the bony bridge, nasal bridge would be reshaped and the dorsal hump also would be removed out, and then by the reshaping, then again by the stroke graft, it is called the stroke graft, then septal cartilage again placed over there and it will be sutured properly, and afterwards the actual incision goes by the suture. Now coming to the next one, that is the rhytidectomy. It is having the two parts. First one is the upper rhytidectomy, that is actually cheek augmentations, and the another one is the lower augmentations, that is actually lower rhytidectomy, that is the neck lifting and all. So first one I am coming to this one, that is the cheek augmentation. So usually the person who is having the asymmetrical features of the face, sometimes some people are suffering from a long, from any kind of disease. Okay, so sometimes their cheek portions become shrunken. Not only that, sometimes due to the nutrition, people are also having shrinkage these portions. So for that, implantation is the one of the example where the small incision will be given over the canine fossa, and through that by the using of the cautery, a small pocket should be made up, and through this pocket the implant should be introduced according to the shape, and automatically these hormonal implantations are just destroying the shrinkage portions and all. So the next one, that is the neck lift. For neck lift, they are also having some, it is like a visible sign for the aging process. If the skin are becoming much more loose, not only that, if their fat is accumulated. Third one, if their horizontal crease of the skin becoming more visible, even the vertical band of the muscles also becoming much more visible, there is the reason of the aging. This is the, it's looking so much aged. So for that, usually the reinforcement would be done by the remove of the liposuctions along with the remove of the excess skin, and muscles will be rejoining again. So in this video also you may see is looking a little bit younger. Next we are coming to the chin augmentations. So it is having the two parts. First one is the genoplasty, another one is the mentoplasty. So for the mentoplasty, who is having the excess amount of the chin portions, it is having so much projection, is not looking that much proper. For that osteotomy is the first, that is the solution. For the genoplasty, whenever it is not that much projected, for that implantation is the one of the example. Minimum 1 to 1.5 millimeter or small incision will be given. Through that the implant should be introduced, and afterwards by the two titanium screws should be closed along with the mandible, because it should be then fixed there, otherwise it may move there. Let's come to the next one, that is the lip augmentations. Okay, usually whoever are not at all satisfied with their lips, they can go for the implantations, sometimes for the injections and all. So usually what to do, the two small incision will be given at both the ends of the lips, and through that the silicone implantation would be introduced through that. this size of the implant is depending upon the patient's own interest and all. Okay? And afterwards, after introducing this small tunnel, then we reposition it, and both of the incision will be closed again. Now coming to the monoplasty. Usually, so many people we have seen from the front also, they are having like a C-shape like here. It is actually look like just like the hockey stick and all. So whenever the angle of the skull and the helix is 20 to 30 degree is normal. Whenever it is becoming much more than 20 to 30 degree, then it is looking just like the panda here. Okay, so for that, a small incision will be given over the anti-helix and the cartilage portions, and the excess amount of the cartilage and the skin cartilage will be removed out, and afterwards the incision will be done. Next one, we are coming to the body contouring. Okay, for the body contouring, the first one is the liposuction. Nowadays we heard this word so much. So lipo is the fat, okay? Alright, because suction is the whenever the suction machines are using to remove out the fats, that is called the liposuction. Usually in the hip portions, thighs and all, but it is doing. So here we can see that the small incision is given to the buttock portions, and by the cannula through that the anesthetic drug will be introduced, and this is the liposuction jar. Through this pipe, it is actually collecting the measuring jar, and after collecting the fats, then again the incision will be closed by the suture. Now coming to the next one, that is the brachioplasty. This is because problem for the woman especially. Whenever the fats is getting accumulated to the triceps and underarms areas, it's looking just like a chicken wings. So just to reduce these areas, at first the marking should be done in this video, and afterwards by the liposuction or the fat should be collected, and then according to the line, according to the marking, by the using of the cautery, the excess amount of the fats and the skin would be removed out, and the skin will be rejoined again. Now coming to the next one, that is the abdominoplasty. Whenever the fat is accumulated over the abdomen portions, to just removing out by the suction process, that is called the abdominoplasty. For that, what to do? Usually for the partial minute is taking 1 to 2 hours. For the full minute is taking 4 hours. So at first the liposuction will be done, and one incision will be given between the 2 and 3 diaphragm, and another incision will be given just below the umbilicus to the symphysis pubis, and the flaps will be open, and the belly button will be restored, and the using of the cautery bleeding will be stopped. And afterwards, the stapling, this is the important stapling will be done, and then again marking should be done. Whatever the excess amount of the skin and fats you have to make remove out. So for the after this making marking, then again incision will be given. For the next, the belly button will be again removed. Just is taking out from the new portion of the abdomen, and for the final touch, again liposuction will be done, and then for the finally the incision will be closed. So next one is the belly surgery. This is also nowadays very popular. Usually, whatever it is having the two procedures. The first one is the restrictive, and another one is the malabsorptive. So usually making to the stomach size is small, so usually it can hold 4 cups of food. So just making it very small, it can hold only 1 cup of food. For that, loop in the procedure usually obtained, which is combinations of the restrictive and malabsorptive procedure. So for that, usually the laparoscopy and open surgery both are recommended, but laparoscopy becoming much more popular. So for that, the 4 to 5 keyhole incision will be given, and through that the cannula should be introduced, which is connected with the catheter tubes. And first one incision will be given to the stomach. It is one small pouch, okay, and it will be stapled up, and afterwards the small intestine, it also will be cut to receive small less amount of the calories and it will be connected with a small pouch of the stomach. And another process is one small window should be made up above the stomach and along with the stapling would be done and a small rigid band should be wrapped out just in surrounding this hole. So by this procedure stomach side becoming very less. So that's why maximum amount of the food could not go through that. So people are getting less calorie and people are also becoming thin for that. Now coming to the next one, that is the buttock augmentations. It is also two types. First one, usually it can be done in the two ways. First one is the reductions of the buttocks, that is the first one. Second one is the just making it fuller and all. For that, two ways is that. One is the implantations and another one is the fat injections. Usually the fat is collecting from the donor part, from the thighs, from the abdomen portions and all. And from the gluteal region, the collected fat from the patient only again introduced to the gluteal region. Okay, next one is the implantation. Usually according to the patient choice, the silicone gel based implant should be introduced through the gluteal region. One pocket should be made up before that by the using of the electric cotton, and afterwards through this pocket this implant should be introduced. Now coming to the next one, that is the thigh lift. Whenever the fat is going to accumulate it, especially in the posterior and middle and the inner thighs. So for that, first marking should be done, and afterwards by the using of the liposuction the fat will be removed out, and then by the incision, usually anterior flap and the posterior flap of the thighs will be removed, and the excess amount of the skin and the fats will be again excised out, and at last it will be rejoining after the incision of the excess fat and skin. Now coming to the next one, that is the one molar scar removal. This is normally we are doing, that is nothing after giving this local anesthetic drug injections, then the surrounding of the mole and scar usually incision will be given, and afterwards if it is required, then electric cotton also can be used to stop the bleeding of the blood, and then we have to close the incision. Now coming to the female genital contouring, male genital contouring. For some mobility problem today, I'm not going to show the videos, but I'm having already those videos. I'm just explaining a little bit about them. For the female genital contouring, breast augmentation becoming much more important nowadays. Especially it's having some clinical importance also. So many times it's happening that the young ladies are suffering from the CA breast. So due to the mastectomy, they are going for this breast augmentations by the using of the implant. So usually the silicone gel based implant can be done by the making of the pocket into the pectoralis major areas, and through that 450 cc implantation can be used there. And next is the labioplasty. For the excess amount of the labial fold can be excised out, and for the hymenography means definitely repairment. So repairment of the hymen also becoming nowadays popular. Next one is gynecomastia for the male genital contouring. Usually it's also having another important clinical matter, because it has been seen that 40 to 60% ladies having the tendency of the accumulations of the fat surrounding the nipples and the areolar areas, and simultaneously there is the chances of the breast, CA breast in male too. So for that, usually the gynecomastia, excess amount of fat and tissues are taken off from surrounding these areas. Next one is the phalloplasty. This is actually for the transgender people who is not the biologically male. For that, usually this is process to constructions of the penis. Not only that, during any kind of accident, people sometimes, especially in the road traffic accident, people are taking off their penis. So it is also forming the penicillin. Not only that, even some people are having congenital problem for micro penicillin, or that is for these cases also it is also helping to constructions of the penicillin. The next one, that is the non-surgical medical invasive procedures. Under that, for the body contouring, those are the points we are doing. So first one I am coming, that is the mesotherapy. For mesotherapy, actually the natural vitamins are injected into the scalp areas, and it has been seen after 4 months the normal growth is starting for the hair. Next one is the dermal fillers. Usually the 3 kinds of dermal fillers agents usually using, like the fat, collagens, and sometimes the hyaluronic acid. Usually this fillers is using whenever people according to the age they are losing their subcutaneous fat over the face, just to make it again plumper or make it fuller. For that, the collagen and fat and hyaluronic acid can be injected to the lips surrounding the eyes and the cheeks portion and all. Now coming to the next one, that is the botulinum toxin or Botox. Usually it is the actually it is the bacterial protein. Its main target is that is it is actually blocking the nerves of the muscles. So whatever the signals are there, it is getting restricted into the nerves. So that's why muscles could not constrict properly. So it is becoming paralyzed. Whenever it is becoming paralyzed, the normal lines of the face also could not be seen from outside. So usually it is making the paralyzation over the muscles for 6 months at a stretch. Now coming to the chemical pills, they are light pills, medium and deep pills. 3 kinds of pills are there. Pill means the actually exfoliations of the upper dermis layer, which is already scarred or formed. So it is removing the scars and any kind of acne scar, traumatic scar and all. So for that, for the light pill, the fruit acid usually using. For the medium pill, gastric acid, lactic acid is using. And for the deep pill, the ethanol is using. Ethanol actually using by the all superstars and all. They are actually the film stars because they are getting traumatic changes in their looking. For that, they are actually obtaining this one. And the next one is the microdermabrasion. We are going the thighs. Aeroplane is having the propeller. Same like the same propeller is using in the small fin. The particles of the fats are just propelled over the outer dermis layer of the skin, which is removing or just exfoliating all the scar marks and all, and that is harvesting of the skin. Next one is the microneedling. This is the dermapen, which is having 0.25 to 2.5 millimeter thickness of the needles, which is helping to just remove all the scar marks and any kind of scar and all, and hyperpigmentation too. For the laser, usually it has this high intensity heat also can reach up to the only epidermis layer, whereas the CO2 or carbon dioxide can just enter up to the 1 millimeter, but laser only the thing which can enter up to the 4 millimeter of the skin to the dermis area. So it is having the power to remove any kind of chronic scar marks also. That's why it can be used not to remove the scar mark due to the acne, even it can be used for the hair removal, okay, and for whenever having the bigger lobule, that also can be reduced by this laser therapy. So now coming to the thermage. In case of the thermage, usually radioactive light usually using, which is forming the radioactive energy, and due to this radioactive energy is helping the formations of the new collagen of the skin. So automatically people are getting the resurfaced face and skin. The next one is the intense pulse light. That is also same light, same is having the indication. It can be used for even the satiness over the palm, dorsal portions of the palm and all, even the neck portions, there for this tightening also it can be used along with the scalp marks and all. Now coming to the next, that is the Ayurvedic aspect. Okay, so whenever the modern science only given the emphasis over the external beauty, then in our Ayurveda it has given the emphasis over the internal and external both beauty. It has been told in our science that actual beauty in the person is it is starting from the Garbhavasta. If the pregnant mother is taking proper diets, if they are maintaining ahara and vihara, that is also giving the effect over the kids or upcoming infants and all. And afterwards it has been told that after birth, if the people are obtaining the Ritujaya properly by the using of proper ahara, vihara, darshan and pushada, they are also getting proper beauty, proper beauty. So for the so many examples are there for the Garbhavasta. As ahara, if pregnant mother is taking much more salt-related foods, then there is the chances in future to get the kushta or various kind of skin disorder. Not only that, if the mother is taking much more sweets, there is the chances of the obesity in infants. And not only that, if they are taking much more salt, there is the chances of the early wrinkles in kids. And for the vihara, it has been told whenever the mother is laughing loudly during the pregnancy, there is the chances of the darkness of the lips in the babies. And not only that, if mother is crying so much during pregnancy, there is the chances of the diminution of the vision in case of babies. Now coming to the dinacharya, is already told in our science that in regular wise people are obtaining the kajal applications or they are doing the dhumpa, karma. It is also not promoting their eyes visions, even it is also promoting their hair's growth. It's stopping the aging process. Okay. Next, another one we are doing that is the regularly also promoting the intellectuality. Now, in case of the Ritujaya also it has been told the Grishma Ritu, Chandana, adorning the pearls and gems should be done, and for the Varsha Ritu, garland and fragrance would be obtained for the purification. And for the Sharada Ritu, the healthy skin and for healthy life, the Hangshoda would be obtained. For the Hemanta Ritu, Abhanga Shira Abhanga should be obtained. For the Prashita Ritu, Vyama and Ushna's Snana with Kampu and Chandana would be maintained. Now coming to the next one, that is the Ayurvedic aspect on the plastic surgery. In our science also over the plastic surgery has been told about the CHIKITSA, Shandana Karma and Amshastra Karma. First one, that is the CHIKITSA, it has been told for the Krushna Dartha or the first degree burn, it has been told that Krushna period drug should be obtained. Then for the Dura Dartha, the cold water bath along with ghee and gold should be given. For the Samud Dartha, the ghee, Chandana, Goli and Guruji should be applied over the burnt areas. And again other cases, broken rice, timuka and ghee should be made up by the voltage of the Patra should be applied. And for any kind of Dagdha, Madhuchishta, Muka, Chandana, Madhu should be applied. Now coming to the Sandhana Karma, I already told Sandhana means the rejoining of the mutilated part of the body. That may be yard, nose or pushta, lips. First one is the Nasa Sandhana. By step are made. As the first step, usually the lip should be kept over the nose. And afterwards, the markings according to the size of the nose and shape, it will be made up. And then according to this shape, it will be again kept over the cheek. And according to this marked shape of the nose, the cheek muscles will be exist out. And this flap, next step, the flap should be covered up over the nose. And then it will be again, at this time the lateral karma should be done to stop the pitching of the bleeding. And at last, as the Pashya karma, Pidajaya, Rasangana, Yashti, Patanga should be applied. And Pida karma should be recommended to patient for the be collected and examined properly. If it is Bata vitiated is there, then the hair would be washed with the use of Dhaniyamla. If it is Pitta vitiated, then it will be washed with the using of the milk. And the last one is Kapha vitiated is there, then by the using of the milk, washed properly. And the next step is the stamina will be done, and then the liquid should be done. And at last, the pitta and quartz powder of the quartz will be applied over the same. Now, next one, that is the Anshastra Karma. Because the Anshastra Karma, we are doing the Rakta-Mishan, Shada Karma, Agni Karma are there. And the Prachana Karma is there. So, for the Rakta-Mishan, just everybody is knowing a small usually what we are doing is just making the inner channels, the chalukas. Usually in South we are practicing like that. From there only this video has been made here. Usually we are using the harina to making them in ourselves. And afterwards, whenever it is becoming, it is moving here and grow. And then afterwards, then we are putting over the affected areas. Whenever it is starting to suck over this area, and it is becoming just like a shook flow activity, but then we are allowed to suck the part. And after sucking them, we are putting the wet cotton over them. And after sucking over them, we are just making them to foam it out by the using of the Saitava Lavana and the Harina to the mouth. And after the proper humidity, keeping this back this jaluka to the jar, individual jar. Okay. And for the patient, usually we are applying the Sakha Uddhavita for the healing of this wound. Next, for the Shada Karma, usually for the cosmetic purpose, the Bindu Akriti that usually we are using. First, we are making red hot.
Dr. Priyanka Ganguly.
Just by the
Dr. Priyanka Ganguly.
Any kind of corn, any kind of small warts is forming over the fingers or over the hand. So, just after removing this red tissues,
61
we are
31 45 40 না এটা হচ্ছে কাকুর গেছে ওম আয়ুর্বেদা ভিআইপি মার্কেট কাকুর গেছে মার্কেট
Coming to the last one, that is the Ayurvedic cosmetic surgery. That is the general aspect and for the general aspect, whatever the procedures are there, giving a small introduction. For the skin care, various kind of hernia, those are all written here. I'm not going to again explain because time is very short. Okay, so for hernia, for means the acne or pimples, for that various kind of has already mentioned. For Sogandha, but everything has been explained here. The next one for the hair care, they are also for the skin care. Another one is very important, is the removal of hair. Most of the people we are doing for the removal of the body hairs, we are going for the salon, but we can also done in our home by the using of this example from of this reference from Shusrita, Anjali Shusrita. Next one, the Tarpana Svimana Svedana, to cover the skin. Next we are coming to the hair care, where the Kesha, Rajika and Karnataka we are doing that is the Jantra, for removing the dandruff, various kind of, now all the formulas are here. I'm not going to again explain because the shortage of the time. Now, coming to the hair care, these are already I have told for the should be done for promoting of the hairs and all. Now, for the eye care, so many house I told here for the breast growth enhancer, for the removing of the post-pregnancy stretch mark, for the multi-somalia and the foot care, various kind of house already. formulations of money they can be used and get the benefit. Now, coming to the it is actually another nature of it. Usually nowadays the hydrotherapy also becoming famous for the contrast part where the cold water and warm water you can use for the increase of the blood circulation. That is also helping for the skin and hair. Now for the weight loss, usually we are doing the Udvartana using the Kotam Chukali, Chunam and all. Along with we may go for the Bhavana and Virajana, and there are various kind of yoga asanas as we told in our science, like Namaskar asana, Padahasta asana, Sarvanga asana, Paschimbanga asana. So those are also very helpful. And for the purifications and various kind of massage already told. The next one is the body life also as we told. Next, Baitika Harana. Okay. So for the Baitika Harana, that is the restoration of the normalcy after getting rid of the scar. How to remove the scar marks? Okay, that has been told by the laboratory. That means whenever the scar marks it is becoming so much whitish, then it's required to just make it a bit blackish. So when it is becoming black or dark, then the natural color will be returned back. So for that, the Bhalataka ash or hoop of domestic animals can be applied. For the Pandu Karma, whenever it is becoming much more black, then it is required to make it more white. For that, can be applied. Another formula also there. For the Roma of the Harana, excuse me, yes. For the Roma of the Harana, Haritala, Shankha and vinegar would be applied. And another one is the Taila, which can be made up from the lizard. Okay, along with the using of the cutlery and the sheets of the Ganguli can be added, which is also helping for the just removing of the excess amount of the gas which is forming surrounding areas of the scar marks. And that also we can apply in our daily life also. Okay. Next one is the Robo Sanjanana. Whenever the scarred areas there is have to replace layers. Okay, so just promoting the growth of the hair, that also we can apply in our daily life. Even there, Hastananta Mashi along with Rasanjana can be applied. Another one is the Kashisa Kapitana Tamala also can be applied. For the Utshadana means when the scar marks are becoming very depressed, we have to make it in the same level of the skin. So that's to make it elevate. Then we have to recommend the patient Mansa and ghee along with some drugs. And Avashadana, whenever it is becoming so much elevated, we have to make it depressed. For that, honey along with some powder. Usually it is one kind of Lekhana karma you are doing. And the next one is the karma. When the scar marks is becoming so much endurance surrounding areas, then we have to make it soft. For that, and for the Daruna karma, we have to make the scar marks or the scar areas much more hard. For that, using of the bark of the Dhava and the Pushpa, Tripala and Priyanka, we may apply. Now this is the end of the part, that is the cosmetic revolution. In our modern revolution, it has been seen nowadays the daily makeup is not at all important. Already cosmetic makeup already. Not only that, the totally color of the eyelids can be changed by the cosmetic surgery. Even for the pump lifeline also can be again made up by the cosmetic surgery. Even the plantations of the mustache permanently can be done. Those are the desired, but still is already established in cosmetic surgery. Even dimple creation, it is also becoming nowadays very popular. And the face lifting, the extremities lifting, just making the people taller than present. For that also came, and for the Botox also applying just to win the match or game for the poker player. That is also came to just hide the expressions for the player. Those are all in the chairs, but still is very popular. Now coming to the complications of of the cosmetology. First one is the chemicals. What kind of chemicals are using that is good or bad, having a dangerous effect or not, especially for the hair. Whatever the formaldehyde is using for making it smooth, and not only that, even ethanol is using for the chemical cleaning. Both are highly carcinogenic products. Second one is the anesthetic complications. Sometimes anesthetic agents can be applied, which is not at all matching with the patients. So this is also becoming a life-threatening for the patient. Not only that hematoma. It is usually occurring during the breast augmentation. This is the common complication. Not only that, even blood carriage. After the augmentations of the breast, there is the chances of the totally loss of nipple sensation for ever to the patient. Next one is the pain and discomfort. It may occur due to the any kind of sanitary infections, even the infections of the any kind of blood. Okay. Next one are coming to the blood loss. For breast augmentation, this is very common. And the next one is the implant failure. Implant failure and the skin graft failure. It is also another cause, which I am just going to tell you a small incident that one lady in America, she after doing the breast implantations, okay, then suddenly she started to bore up by the aeroplane, and then she started to feel something discomfort. She felt the implanted portions becoming suddenly larger, and suddenly it's totally burst out, and then immediately she just died. So this is the one of the method that after doing the implantation, the risk should be done. If they are becoming mobile, there is a chances of the failure of implantation, even that's becoming life-threatening too. Seroma usually is the pulling of the blood just behind the skin. So it is also very common factor for the abdominoplasty. From definitely dissatisfaction and scan. So after doing that much plastic surgery, cosmetic surgery, when the people are thinking, oh, previously I was more beautiful, why I wait for this surgery? That is the biggest problem for this cosmetic and plastic surgery. Especially. Next coming to the those are the figures, those are the personalities we are doing who all went under this cosmetic surgery, right? And those are the persons also we are doing who went under the failure surgical procedures. So they became from beauty queen to vampire, right? Next coming to the conclusion. As the conclusion, before conclusion I want to tell the one thing, that is what we may do as a research work in the hospital. Okay. As I have told about the mesotherapy, we are applying the natural hormones, right? The natural vitamins. So we may think about the infiltrated, not infiltrated, that is the alpha property of the herbs that we may apply after doing the distillations apparatus, and we may think about it and we may go further research. Next one is the dermal filler, also the same property. We may think about the injections and the chemical peel. We are ideally covered. Why should we go for the chemical peel? We should think about the herbal peel. And the last one, microneedling, that I have already seen. Prachana, we are having the Prachana karma. Why should we go for the microneedling? Usually in Kerala also is becoming very popular. They are using the Prachana karma. Afterwards, they are using the Maricha along with this Keshavardhan oil they are applying. This also helping to promote the growth of the hair. So now coming to the conclusion. Yes, whenever it is required, definitely sometimes it is required, sometimes not at all required, just to rest our money. Because sometimes people are definitely having some, after the mastectomy, they should go for the implantations of the breast. If someone is having a clear planet, they should go. Okay, then if attachment is required, they should go for that. But sometimes only making the lips fuller, just making the lips fuller, people are going for these surgical procedures. Those are exactly luxurious and waste of money. Another one is the hiding of the appearance. Sometimes the criminals just hiding their appearance Okay? At last, I want to say one thing, that is, don't be panicked by your gray hairs and by your wrinkles and all, because age is just a number. Okay, your mental, whatever you are having, your personality, your confidence is everything. That is your actual beauty. That's why we are keeping our president, our ex-president APJ Abdul Kalam, to our heart. But we are not doing this just by his external appearance. We are actually keeping him to our heart for his wisdom, for his personality. So don't be panicked, be cool, be natural, and enjoy life. Those are the references. Thank you.
Thank you, Priyanka. Thank you, Dr. Priyanka Ganguly, for this lengthy, informative presentation. A questionnaire schedule will be discussed at the end of the session, and I have to leave this program. Dr. Mukhopadhyay will conduct the remaining part of the program.